Dr. Nancy Elwertowski Cooper, and we're at 2000 East 116th Street in Suite 101 here in Carmel. I'm a chiropractor that specializes in pediatrics and pregnancy. A lot of people don't realize that chiropractors can specialize in that, and basically the reason we treat kids is that the spine and the nervous system control everything in your body. So when there's any bone out of alignment that is in your spine, it affects the nerves coming out of that part of the spine, and the nerves control the organs and the functioning of your body. So if there's pressure on a nerve, then whatever that nerve goes to isn't going to function. And it can be as much as the weight of a dime pressure on a nerve that can cause a problem in this body. So the kids that come in, that we're not seeing them for back pain, they're more health issues. So we see a lot of kids colicky, they're not sleeping very well, they may have chronic ear infections. And then the older kids, we look at posture and make sure that their posture is right, because if their shoulders aren't level, their ears aren't level, that tells us there could be a problem with the spine, shifting out of alignment, that's causing possible nerve irritation. We do treat children like babies. I do a very different technique than I do adults. I do a little more soft tissue work where I work with the muscle, and the adjustment to the spine is very, very gentle. It's not anywhere near what I do with the adults. We use, sometimes I use a little activator gun, which is a low force technique, like a little clicky. Sometimes you hear about people using a little clicky thing. That's what we use. Or I just use a myofascial release on them. That really helps take the pressure off the spine. Yeah, and the technique I use on infants is called a myofascial release, and it's muscle, releasing the muscle. So then we release the muscle, and then I can find the bone, the part of the spine that is out of position, and gently kind of tap it either back into place, or we use the little, activator gun. It's very gentle and safe. Some of the reasons that people come see me, mainly I see a lot of kids with the ear infections, and there is a mechanical factor to the ear infections where the fluid doesn't drain. So when you're seeing your child get recurring ear infections over and over, and they've been on multiple antibiotics and it doesn't seem to be helping, one of the problems could be a mechanical part, which I can determine. And then another could be like food sensitivities, which I also can look at too. The mechanical part is that bone that's out of alignment. It's making the muscles tight so that the fluid from the ear won't drain down through the lymph nodes. And so it just pools up there. And then anytime they're exposed to a virus or a bacteria, that's where it sets in, is right in between the ears, and then they get an ear infection again. So once you release that mechanical component, the muscles relax, the fluid can drain, and then the ear infections go away. This is actually in adults and children if the sleep is disturbed, and that's in the adults. Sometimes I'll get them with people come in because they're not sleeping well again, and they get adjusted and then they sleep well. Well, the same goes for kids. If the babies aren't sleeping, they're restless. It's very possible that the adjustments could help with that too. Older kids, we look at a lot of the posture because they're standing. And what I look for is to see if a shoulder's higher, one shoulder's higher than the other, if the ear is higher, or if the eyes seem like they're off, the hips, to see if they're off. And if we can catch it early enough, we can prevent a scoliosis from occurring when they're older. Now these are scolioses that aren't congenital. These are ones that nobody knows why it happened. Because when the bones go out of alignment as they're young, then the body kind of curves and grows around that, and as when they get older. So getting their posture checked when they're younger can prevent problems from when they're older, especially if you have a family history of back problems. Sometimes when you get it when they're young, they won't have the same problems the adult does. I worked with some autistic kids. Autism is more of it's a neurological and a biochemical problem, and when you release pressure on the nervous system, then it works. I had an incident of a child that I worked on after his first treatment. I think he was 4 when I saw him. But after his first treatment, he started talking, and he was on the autism spectrum. So it can make a difference in how the child functions when they do have autism. I see children trapped in mommy's tummy. So I work on mom when she's pregnant, and then we see the baby right away as soon as mom can get here. I have done home visits because I have some moms that deliver at home. So I'll go to their home and actually make sure the baby's all in alignment and ready to grow right from birth. But the first appointment takes about an hour because I do a lot of talking about the birth history, the other history of how they've grown up so far. The examination, I'm kind of examining them while I'm talking to them because kids are fun. Sometimes we have to run around the room with them to chase them. And then after we determine what's wrong, really seeing kids, it does not take that long, maybe 3 visits or more. But it's not anywhere near the frequency like we see adults. Because they're still young, the muscles don't have that memory yet, so when we do work on them, the muscles can hold what we've done, and we don't have to retrain them like we do as adults who have the longer muscle memory.